So, good evening to one and all. Welcome back to Homeo Vision 2050 webinar series session. Here, me, Dr. Aditi Malkani, BHMS PG scholar from Srimati K.B. Abbad Homeopathic Medical College, Chandwad, Nasik, Maharashtra, would wholeheartedly like to thank Dr. Lavanya Sai, BHMS MD Homeopath, PhD scholar, National General Secretary of AHISYA, All India Homeopathic Student and Youth Association. Also, I would like to give my sweet regards to Professor Dr. Nivedita Patnaik, National President of AHISYA, and also I would like to thank Team AHISYA Webinar Organizing Secretary Professor Dr. Arpana Sandeep Parikh Ma'am, Professor and HOD Department of Repertory from Srimati K.B. Abbad Homeopathic Medical College, Chandwad, Nasik, Maharashtra. Here, I would like to welcome our today's speaker of Homeo Vision webinar series organized by AHISYA. Today's guest speaker, Dr. R.Sakthi Sir, Professor in Department of Repertory, RVS Homeopathy Medical College and Hospital, Coimbatore, Tamil Nadu. I would like to welcome our today's speaker, Dr. R.Sakthi Sir, and I would like to introduce him for the topic of today's webinar, Utility of BBCR in Knee Osteoarthritis. Here, I would like to give the over to Dr. Sakthi Sir and kindly continue with the webinar, sir. Give detailed insight on the interesting topic.
Sure. So good evening to everyone. So sorry for the technical difficulty. So here I am thank for giving me the opportunity to present for the Homeo Vision 2050 organized by AHSAYA Akshya team. So I really thank for this opportunity. So today our topic is about utility of BBCR in knee osteoarthritis. So we all know aware about the great, the legend Dr. Cyrus Maxwell Boher, who have given a great contribution to the homeopathy in his ideas and about his innovation from his author Dr. Boninghosen, whatever he inspired and he got incorporated in his own analogy, and he made a new system of approach following with Dr. Hahnemann and Dr. Kent, and he made the great literature work, especially the Boher-Boninghosen characteristic repertory. So this repertory is highly utilized for the all the kind of the chronic diseases and even in acute diseases, and also in a pathological manner, the complete symptom. And if the case have a proper complete symptom, surely this is the one of the highest repertory. If the case have the pathological general, if the case have a proper concomitant and modalities, surely we can work on with this. So I got inspired from many doctors, so working on this particular repertory. So here I have worked certain cases related with the osteoarthritis of the knee joint. So coming to the proper osteoarthritis of knee, so it comes under the ICD 10 CM diagnosis code M17.9. So the major disorder regarding osteoarthritis, the pain and the disability, and also as well as the difficulty in joints, it restricts the routine movement of the human beings. So majorly nowadays, the most of the people, even from the age of 35 and on the 40s, also begins with a certain kind of osteoarthritis, especially the knee, due to their lifestyle moderation and because of their irregular pattern of the kind of regular non-disciplinary work. They are not following the regular healthy lifestyle. So the things are starting very early. So very commonest thing we see in a patient, especially in osteoarthritis, the pain, stiffness, the swelling like symptom. Within a short period of time, it develops, and also we have the good level of homeopathic approach when compared to the allopathic mode, we have a good approach apart from all other treatments, because we have the more number of medicine, especially treating on a constitutional manner and also in a pathological manner. The coming to here is about where our approach is about Boger Boninghosen characteristic approach on a knee osteoarthritis. So selecting an appropriate medicine according to the modality, whatever the patient coming to our clinic, and what is their mode of the presentation, and what is the causative modality. So those things which helps to find out the most suitable appropriate remedy to the respective patients. So we have done so many appropriate the cases suited to the BBCR with the knee osteoarthritis. So generally we all know that it is a degenerative joint disorder. Surely it presents with the chronic pain, stiffness and reduced mobility. The major important thing what is happening in osteoarthritis is about degeneration of cartilage and joint space narrowing, osteoformation and synovial inflammation. So these are the commonest thing. Surely we will expect degeneration, osteoid formation, and synovial inflammation. So these things which causes the pain and swelling and restricted movement, and it prevents the quality of life, which is the higher prevalence nowadays, which happens in globally. So uh, moreover, the cases are treated with many kind of the corticosteroid injections, physiotherapy is done, and some cases refer for total knee replacements and all. So, but even though there doesn't have a proper relief in the osteoarthritis cases, so here we have a good approach, which surely given constitutional approach and also the holistic need what the particular individual needs, because other medicines brings out the various GIT issues, renal damage, and depending on a particular keep on taking the drugs, surely it brings out the very comorbidities in the particular patients. So the one important thing here in homeopathy is about we can give a good result when we select a medicine properly according to the repertory. Especially we can provide a constitutional approach, and what is the really patient's need. The patient exactly need is about the relief from the particular complaint. So that's what. So you all know the pathogenesis. It is because of a triggering factor, biochemical triggering factor, degeneration, formation like osteophyte, inflammation, degeneration. Then is about central sensitization, biochemical diseases. So all those things which has an impact and creates a clinical sign and a symptom in a patient. So this is about the pathological approach. So in case of more development of pathological approach, so sometimes the patient may not have an insight of how we can able to come out of only with the homeopathic treatment. So we are in a generally before starting a treatment, we'll give the explanation regarding how homeopathy really works, how really it brings out certain changes, especially in their inner the pathological conditions. So most probably the common symptoms expected is about the deep pain, aching, discomfort, resting pain, even in the night time, the continued nocturnal pain. So the kind of unusual the pain. Apart from this pain, so what we see is about how and when and where it starts, what is really the source of pain. So those kind of modalities, and especially with the concomitant, we can able to bring out the patient from the particular the joint damage and pain intensity. So apart from this pain management, we can able to improve their environmental disturbance also. So there are more number of patients we see with the joint line on the lateral form. And one more is about heart swelling is also considered in a certain patients. And certain patients we found that synovial effusions, then the kind of deformity patients also seen. In deformity patients, we can able to make them out of pain. That is a more probable thing we can able to do in that particular patients. So genetic factors and all, surely pain management can be done. Apart from if it is developing during their lifestyle, surely bring out we can bring out the normal life by giving a proper appropriate stimulum by selecting from the BBCR. So The common expectation is about morning stiffness. It lasts for 30 minutes. Then already we have said about it is about a full tightness. Most people will present with a stiffness in their presentation, pain, stiffness, the restricted movement. This is the very commonest thing. With they cannot able them to move in their regular routine life, and other kind of patients will present with the sound crackling sounds. So these are all be found through the clinical examinations, especially on local examinations. So we need to educate the patient why it is happening, and we need to find out if there is any kind of other the disturbance, like any we need to check out their BMI, body mass index, whether it is appropriate to their height and weight, and we can advise certain exercise, then orthotics management, the modify their activities, and the other non-pharmacological interventions like there are so many things are followed nowadays. So acupuncture, spa therapy, yoga. Even though the most people follow this kind of non-pharmacological intervention and also the pharmacological drugs and also surgical, they cannot able to come out of the original pain, disabilities and restricted movement. So here we approach with the emotional and pathological aspect. Both the things are valid. So here the BBCR, his idea is about applying the medicine not only over the particular location. He want to give a get rid of from the sensation and what is the really suffering the modalities and what is the concomitant to the respective symptom. So when we select based on this particular aspect, it brings out the major effective changes in the patients. So certain patients will have aggravation from cold, then about their modalities, amelioration by motion, and the particular sensation. So these are the highlights of the certain modalities and concomitants, which helps to found the strong right remedy to the particular patients. So here we have the boning of an approach of concept of totality is about based on a personality, based on a disease, based on a seat of the disease, and based on the accompanying symptom, what the patient is suffering from, and real cause. So once we found out the proper cause, the modalities and time factor, surely with the help of this, the BBCR and the approach of totality concept, especially given by Boning Awesome, we can help the patient to bring out the respective changes. So overall, what Boger method prioritizes? Causative modalities, aggravation, amelioration, concomitant, pathological general, sensation location. Most probably, we speak about the BBCR, the sense of only pathological general. Not only a pathological general, it has an aspect of modality factor, causative modality factor, and environmental factor, temperature factor, and is about the individualizing symptom, the characteristic symptom. So what kind of real sensation happens in the patient, that helps to finding out the real exact cause and real exact things happening, changes when we start matching and finding out those symptoms. Surely we can help them in their pain improvement. So we all know that very common remedies: bryonia, restox, the calcare, the ledum pol, causticum, sulfur, arnica, pulsatilla, calica, silicium. So when approaching these kind of remedy, even only with the modalities, only with the concomitant, the remedy is not going to work. The remedy is going to work if it have a proper characteristic. Surely if it is matching with the respective component in a patient. So it is good. Certain happens. So some patients, not some patients, so most of the patients, particular more number of emotional stress because they cannot able to do their regular routine activities. So the emotional disturbance also happens. So here the Boger, even though he have a limited approach in the mental analogy, we can use those rubrics also in applying this kind of regular constitutional remedies. So especially we need is about proper causation. Here I have given a sample rubrics. If it is started with the over-exertion, if it is started with the getting wet, surely we can need to be considered. And if it is aggravating, ascending factors, if beginning to move, or is about amelioration factor is continued motion. Some patients will have a warmth amelioration. A particular location, sensations like drawing pain, the describing pain from the patient is very important. So we cannot able to ask the direct question. We can ask them to explain certain things, how the pain is present. So those things which can helps to they connect the component of the particular patient and also to the respective the BBCR approach. So when this together happens, surely we can bring out the major changes in the patients. So concomitant is essential, generality is essential. So here are certain rubrics, especially in the lower extremities, with the different kind of sensations like the band around, the beating and throbbing pain, the melting inward. It has the drugs, the kind of internal, the joint like boring pain, the bruised pain, burrowing, the crackling joints. Each the number of rubrics which consist of a number of remedies. This remedies surely, if it is matching with the respective patient, surely it's going to work on a patient. So cutting pain, dislocative pain, feeling joints. There are so many number of rubrics all over with the lower extremities, like the dryness sensation, eruption, excoriation, the fatigueness, the knock knee in case of any kind of the kind of the gnawing joints, gout-like pain. So here are some other the heaviness, humming, the kind of inflammatory factors, itching, jerks, the knock together, lambing pain, and muscle contractions. So few more rubrics regarding lower extremities. Start from the numbness, the pulsation, curing pain, the kind of restlessness, sensitiveness, shooting, and short acid. So here are the certain lower extremities rubrics along with the mental approach, along with the pathological general, and we need to exactly extract the what is the real aggravation factor, amelioration factor. So altogether, based on the higher priority in the patient, some patient will have a higher priority in the modalities. Some patient will have higher priority in their causation factor. Some patient will have higher priority in their pathological factors. Some patient will generally present their the complete symptoms. So based on the approach, we can able to. So here the one more the case regarding the age of 40 years, the female, okay, who presented with the right side knee joint with joint knee. Especially the modality we can able to find out is about the time modality factors. So aggravation and amelioration at motion, and especially the continued amelioration brings out. So here the kind of presentation, what things make the person very worse, what thing which make the person very worse. Along with this, we found certain physical generals. So together we made a repertory. Finally, we found the pulsatilla, restox, bryonia like. So moreover, it looked like every remedies all with the constitutional factor, but here higher constitutional with the characteristics, the finally prescribed the remedy called pulsatilla. Within a few number of weeks, we can able to found the pain improvement in the patient. Then later on, stiffness is improved, and they can able to find out a difference in their modalities. So the another case is about the kind of the pain here. It represents the shooting pain. The aggravation factor is about cold. The amelioration is about rest. Even though it looked like very common, here the another thing is about the mind factor is about restlessness, and physical general we can able to find out. So placing of these kind of factors, the patient is presenting with both knee joint. Finally, the remedy found is about, we can able to see the other number of drugs, Restox, Mersol, Nexomica, Pulsatilla. So the aggravation, especially in the cold and shooting pain, along with the kind of the restlessness factor, finally we prescribed with the drug called Restox. That brings out a immediate relief within a week in this particular patient. And one more another case, the patient presented the pain like the bruised pain. And you can ask, you can think like these kind of patients is diagnosed osteoarthritis after exposed with the X-ray with the presentation of osteophytes and the narrowing joint space. And here the first management is about the pain management. And if depends upon their lifestyle moderation, we can bring out the changes in their internal pathological changes. So here the another case is called excoriative pain. The one very important modality is about even touching itself. Even touching itself brings out a aggravation. The kind of inner excoriative pain is present in a patient. So the patient has an the previous few weeks back he got an injury over the particular extremities, so he cannot able to find the particular, even the touch is also aggravated. So when he go through the then after the shock, after the injury only, when he found that after x-ray he found that there is a changes in their diagnosis. So he went on with the various steroid drugs, but it doesn't work on a particular patient. So he came to the clinic with the kind of the compliance, so especially with the right knee joint. So worked on the particular repertorization. We found that Nexvomica, Pulsatilla, sulfur, bryonia. Finally, why we prescribed the Nexvomica. Here is about the amelioration factor. We doesn't consider about the aggravation factor, especially another aggravation factor is about the touch and is also the injury. So these modalities which helps to work on the respective patient and bring a major changes within a week. Then another case, here another case you can find that right joint as if band around the joint, right joint as if band around the joint. So ascending, lying in a bed got aggravation, especially a female. Amelioration because of doing some household works and kitchen works, the continuous standing, the cramp is found probably because of any electrolyte weakness. So the patient is also taking medicine for the diabetic, and because of this particular complaint, she got more anxious, and the kind of internal agony is developed, especially epigastric region. So this mental general and following with the particular pain, we can able to find that respective drugs. So in this patient also, we started with the respective drug called Nexvomica, following with the loading dose. Here I have given the continued loading dose for a week, about a 30 potency. And the next second week, I have given a Nexvomica 200 OD every day morning. And few weeks, we can able to see a external, the kind of the pain, whatever the band around the joint, knee, they feel a kind of sensation is very, very less. The stiffness is reduced. So while lying in bed also, they can able to find a little bit changes. So here is another case of female is about because of the continued loss of vital fluid. The patient also have an dysfunctional uterine bleeding also, and because of the continued loss of vital, so worn out feeling, especially the numbness, stiffness is developed in the joints. So he totally, because of this particular complaint, she keep on getting anger in doing the work, and she got vexed. So finally, I want to the match out the components of mind and the numbness and the loss of fluid. So together, it brings out the beautiful remedy called sepia. So finally, the drugs are prescribed. The sepia is prescribed with the continued loading, not loading dose, especially the OD in the morning, and within 10 days she got an improvement, and it is also a wonderful case. One more case is called to be the lycopodium case. So here the only the knee joint is very simple. Aggravation amelioration factor, the time factor is about a night, and prickling in the foot soles. It is a very common thing. It is about, especially in this patient, he keep on saying during the time of complaint. So especially I'm having a pricking the foot soles. So when I found, it shows the particular rubric. The finally, along with this particular complaint, we can able to see the physical general excessive. So there is about the appetite is highly excessive. So together we found initially I want to prescribe with the Staffy, but based on their thermal and based on their the kind of the constitution, I want to start with the lycopodium 30. 30 is about a continued dose, loading dose. The following with the second week, lycopodium 200, especially in the morning time. That also bring out the major changes. Then one more case, age of 63, the female, the right knee joint, the swollen sensation, the open air patient. One more is about washing feet. Then especially the anxiety felt at the epigastrium, the kind of even though they have the sleeplessness night, finally morning it feels very insufficient. So here I have the patient based on their thermal, based on their respective constitutional. I want to give the drug called phosphorus. Initially, I had a certain doubt in prescribing, but first 2 weeks the patient not able to come for a follow-up. When I found third week, finally the patient came with the good improvement. So here are the few cases. Overall, I have seen the few number of cases which approaching with the proper modalities, causative modalities, concomitant based, pathological based, Robert method based. So we can able to the few number of cases I have done, especially the modality based drug given is given high number of improvement. Then one more is about Robert method, the complete sensations. It's about the complete symptom that also give a high improvement. So the follow-up we have advised, especially we want to see the how much level of degree of pain is improved, how much level of the frequency of pain is improved, what are the swelling, how much level swelling is improved, the stiffness improved. We need to note down all the restricted movements. Then we need to inquire with the whether their regular routine activities like walking and about their going upward and downward stairs, the standing more standing, whether it's troubling them. And this for some people with the ages of the 40, they doing some sports and all, so it's very difficult. So we found after prescribing with the BBCR, their sports activity, their kind of the shuttle activities get improved well, and their quality of life is also improved. So here, especially in this BBCR approach with the respective rubrics, we can able to with the proper adaptabilities of BBCR methods, we can able to find out the high level of improvement. So the complete symptom totality brings out a very higher number of significant improvement in a various number of knee osteoarthritis patient. So by approaching this kind of patient, so some patient will have always have a panic, they want to go for a surgery. So if you have a proper contact with the respective the specialists like orthopedic and physiotherapist, we can give a suggestions like you can also provide drug before you starting with any kind of drugs. So it is about giving a proper interdisciplinary integration with the respective doctors. We can find before starting any kind of surgeries, surely we can ask the patient to start with the particular drugs. So here most of the patients affected is about 55 to 65. The male is compared to male, female is affected. And after prescribing with the medicine, most of the cases we found that markedly improved within 2 weeks. So that's what the more than the invasive therapy, this non-invasive therapy, and this non-pharmacological options, especially the holistic management, brings out the drugs selected from BBCR approach, which helps great improvement and management in knee osteoarthritis. Initially, we found only the pain management, later on with the stiffness management, and later on with the restricted movement management. And finally, in few cases, the pathological area need to be improved well. So overall, this is my presentation. Thank you. Thank you, everyone. Hello, ma'am. Thank you.
Thank you, sir. Thank you so much for the wonderful session, sir.
Yes, ma'am.
Respected participants, if you have any doubt, kindly comment in the comment section so that sir can answer the question. Yeah.
Any of the participants have any kind of doubt, you can get it clear.
Anyway, thank you so much, sir. Thank you so much, all the participants. So, Aditi, so kindly check it out the end part. Yeah.
So I thank All India Homeopathic Students with and Youth Association for this kind of opportunity. Thank you all. Proceed.
Thank you, sir. Uh, we will be looking forward for many more sessions, sir. Thank you so much. Yeah, sir.
Sure,
Thank
ma'am.
you.
Thank you so much. Thank you, ma'am. Thank you.
Okay, sir. Thank you all.